Welcome to today's Commission on Excellence and Innovation in Health Improvement and Innovation Showcase. Today's showcase is in Series 11, which is our Strengthening Healthcare Workplace Wellbeing in South Australia series. As I've said already, my name is Katie Billing and I'm your host today. Before I go any further, though, I'd really like to acknowledge that the land that I'm on today is the traditional lands for the Kaurna people, and that it's the Kaurna people and that we respect their spiritual relationship with their country. We also like to acknowledge the lands of the traditional custodians wherever you might be joining us from today. And also really just recognise the heritage is just so important and still important to the living Kaurna people today. I'd also really just like to provide a bit of a background that I'm in a really noisy environment today, so there might be a little bit of background noise, and our guest presenter is also in the same boat, so I'm sure that you'll bear with us if there's a little bit of background noise that comes through the speakers, and I've just had some of it then, apologies. So just quickly before we get moving, to talk you through the Commission on Excellence and Innovation in Health. For those of you that aren't familiar, we're the lead agency for innovation in healthcare in South Australia, and our work is to bring together consumers, clinicians and collaborators to turn ideas into better healthcare. Our vision is together, let's create better healthcare for all South Australians. To do this, we need to support the sector to come together to imagine ideas for better healthcare. We also acknowledge that better isn't always excellent, but we do commit to measuring what we're doing so we can see changes. So what if the big idea was connecting all the small ideas? This is the idea of the Improvement and Innovation Showcase. So really what we're about is helping in this forum to connect people in South Australia and across our sector. It's about sharing improvements and innovations and sometimes both of those things. The Improvement and Innovation Showcase is a series, is run as a set of series, and it's on Thursdays. We run it online at 1 o'clock, and that was sort of an arbitrary time that we get everybody together for the live sessions, but then we were able to provide those videos online whenever. It's about bringing together healthcare teams from across the system, and it's also about providing a space to explore what others have learned. We aim to keep it simple and share work that's happening across the sector at any stage, and also a level of success. So it's an opportunity to share the things that you've learned, perhaps not from the most successful stories as well. We do focus our work on South Australia, but now and then we showcase outside of our state as well to be able to ignite ideas. So just a quick prompt, I guess, that if you have a problem or you've had success in solving a problem, whether you've learned something whilst trying to do so, or if you've got any themes that you'd like to see explored, please feel free to get in contact with us via the email address that's on the screen now. We'd really like to hear if you've got a story to tell. Very briefly, I guess just wanting to talk about why workplace wellbeing and why this is such an important investment for CEIH. At the CEIH, we know that our healthcare workers need to be safe and well to not only thrive in their professions and have the bandwidth and the capacity to go beyond and continue to innovate and to provide world-class patient care. CEIH are committed to applying global best practice to the South Australian context and supporting the sector to create a culture of workplace wellbeing at all levels. And so to support this, we've produced a range of resources and tools which are available on our website, and the link is there, but really just an opportunity for us to bring the showcase to you so that we can share some of the wonderful things that are happening. We're up to the, the 21st of September. So the final of the showcases in this series. We've heard from some great presenters throughout, and we're really excited today to bring you our presentation from the wonderful Dr. Alison, who is an emergency physician in Southern Adelaide Local Health Network currently, and the chair of the Southern Adelaide Local Health Network Wellbeing Committee. Alison is here to talk to us today about Schwartz Rounds and her experience of Schwartz Rounds and really just to share some insights with us about Schwartz Rounds. Alison, I'm going to hand over to you. If I stop sharing my screen and you start sharing yours. and then we'll be able to hear your story.
That's great. Can you see my presentation, Katie?
That's perfect, Alison. We're good to go.
Wonderful, and thanks for that beautiful introduction. So good afternoon, everyone, and thank you all for the opportunity to speak with you today on a topic that I so passionately believe in. I do have some reservations about being labelled as an expert in this field, but I'm more than happy to share my experience and reflections with you today as a human, trying to seek and improve compassion in our workplace. I should add that my Schwartz journey from participant to leader has been a fairly long one, interrupted by 2 international moves, thanks to my lovely husband. And the business case that I originally wrote for one institution in 2016 was finally adopted in 2022, 3 institutions later. So it's taken a while. Thanks, Katie, for the introduction. I am one of the ED consultants here at Southern Adelaide, and I am chair of the Wellbeing Committee, and I'm also delighted to be the clinical lead for Schwartz Rounds. I'm aware that not all of you will have experienced rounds, so I do plan to try and share this experience with you a little bit later in some more detail. I personally became involved with Schwartz Rounds as a participant during the final years of training in the UK, and I was really astonished regarding the impact that these conversations had on the culture of the institutions that ran them. As an ED clinician, I pretty much only call people to give them more work, ask for their help, or deliver bad news, which can generate some despondence on call 10 of the day. But the personal reflections that I made during rounds regarding how I make these calls, the impact that my tone, my language, and my manner has on both my colleagues and my patients, and the compassion that I can bring to the wider team has really stayed with me and changed me. The link between these small improvements in compassion towards ourselves and others has a really much larger impact for patients, and the evidence for this is really quite plentiful and growing by the day. I would like to start by listening to that impact described by Kenneth Schwartz, who was the founder of Schwartz Centre Rounds for Compassionate Care, in his own words.
We're rolling? Everything right? Okay, good. Just so we have it on the tape, we always do this. Give us your full name, spell it, so we have it spelled correct.
Kenneth Schwartz, SCHWARTZ.
What do you want to do with the time you have remaining, whatever it's going to be?
There's no question that one of the things I'm going to do is try to extend my life as far as I can. And I spend a lot of energy trying to find the best possible, cure, the best possible to extend my life. And I'm willing to undergo a fair amount of pain and suffering. That's number one. And I do want to continue, if I've gotten a little bitty willing pulpit from this article, to use that to try and send the message that we have to allow time to care. We can't be satisfied with mediocrity. And each one of us, if God forbid we get a serious illness, none of us know when or how. I can never imagine it would be me, non-smoker, relatively good eater, worked out every day. And if it happens, God forbid, each of us is entitled, deserves the best possible care, not just of our body, but of our spirit. So I want to spend a lot of time with my family. 4 years old, I have a 2-year-old son, a young wife, a lot to live for. A wonderful network of close friends, who, in addition to the caregiver that have been just a wonderful source of support. So spending time with them and my family, and I think that's how I'd like to spend my remaining days.
Ken Schwartz died in 1995, and his family were tasked with his legacy of improving compassion within healthcare workers. Having absolutely no idea where to start, they asked the team that cared for Ken in his final illness what they needed to be more compassionate in their work. Their responses were pretty simple: time, space, a place to come together to talk about the things that happen in our workplace that nobody outside of that workplace can possibly understand. And from this, Schwartz Rounds were born. Rounds are a place where people who don't usually talk about the heart of their work are willing to share their vulnerability, honestly express the emotions that they feel in the course of their duties, and to question themselves. This programme provides an opportunity for a dialogue that does not happen anywhere else in the hospital. One of the greatest opportunities of Schwartz Rounds is to bring together in conversation and community colleagues who do not typically interact with one another for conversations that we just typically don't have. In contrast to most medical meetings, all staff involved in healthcare are involved. Hierarchies are removed because we embrace the diversity of our participants, understanding the great impact that each individual has on patient care, regardless of their discipline. My current member advisor at the Schwartz Centre describes one of the most powerful rounds she's ever been involved in was listening to an orderly at her institution talking about the journeys that they make with patients, and how the last one, the journey to the mortuary, is always so very hard, but how they have found a way to manage this with respect, dignity, and care. I understand that this panelist received a standing ovation after concluding his story, and the impact for him, the recognition of his role in that patient journey, is one I would like to echo again and again throughout the teams in every round we do. Rounds are run off a set license from the centre in America, with organisations committing to fulfil certain unique requirements, following a very strict format requiring specific facilitator training and panel preparation. Great efforts are made to establish and maintain both confidentiality and psychological safety within rounds, because the focus has to remain on the emotional and social impacts of the job we do. This is neither a forum to problem solve or apportion blame. Kenneth's legacy was passionately embraced by centres in the United States, and quickly news of this unique forum spread. Currently, there are over 600 institutions regularly running rounds in the US. Evidence was clear that rounds transferred across institutions were applicable in multiple settings, be that acute care, community, hospice, but also in educational establishments. There was a review commissioned across the US of 35 different centres, which demonstrate that organisations that place a high priority in delivering compassionate care benefit financially from lower staff turnover, higher retention, recruitment of more qualified staff, greater patient loyalty, and reduced costs from shorter lengths of stay, lower rates of rehospitalisation, better health outcomes, and fewer costly procedures. It really does pay to be compassionate. Patients who are treated compassionately also benefit from improved quality of care, better health, fewer medical errors, and a deeper human connection with their caregivers. Compassion also really does save lives. Success, however, in one setting does not determine success elsewhere. The efficacy and sustainability of Schwartz Rounds in an alternative setting where the cultural context and systemic challenges are different to that of North America is not guaranteed. There are significant barriers to rounds, particularly where budgets are tight. And in addition to the fees, other barriers preventing success within organisations include an understandable hesitancy to invite public sharing of sensitive cases, both for staff welfare concerns, but also confidentiality. Resourcing. We need staff to have time to actually train and deliver these rounds properly. There's lack of engagement and a perception by staff that they don't have the time or are not permitted to attend these, which is something that we really need to work at an organisational level to change. Also, it's difficult. There's an unknown benefit. These rounds appear mysterious, which can prevent its participants manifesting some scepticism rather than showing up and attending. It did help in the UK that the GMC recommends engaging in reflective practice and links this not just to effective leadership skills, but also improved quality and safety for patients. They have earmarked this as being a good marker of professional standards, and we are fortunate that APRA in Australia feel the same. As is sadly often the case, it was tragedy that made the case for pilots to occur elsewhere. Back in the UK in 2009, I was a senior registrar in emergency medicine and a fairly new mum. Stafford Hospital was 80 miles south of where I lived and worked. The mid-staff scandal dominated the UK press with hugely distressing stories of how targets were prioritised above the quality of patient care. The impact that this had on me personally and professionally was huge. It's really hard to admit that you can draw certain similarities to your place of work and one so publicly reviled, whilst at the same time being deeply proud of what you do, where you work, and the team that work with you. My non-medical family had so very many questions. How could this ever be allowed to happen, Ali? My father, who sat on our local hospital board, was incredulous, wishing to dissect literally every media article on this. And my bosses fairly felt the pressure that we could not be the next mid-staffs. If you feel accreditation is a tough ride here in Australia, a visit from the CQC in NHS is next level bad. The Francis inquiry into the gross failings of mid-staffs linked between 400 and a possible 1,200 deaths to poor quality care, and it was a catalyst for multiple recommendations and changes within the NHS. 290 recommendations were made, including an urgent need to improve compassion amongst healthcare workers, with a recurring theme through the report being a lack of compassion shown both to patients and to staff. For the first time in my training, compassionate care was not only openly discussed, but seen as a vital component in patient safety. The lens was also focused firmly on the importance of compassion and civility towards our colleagues. Speaking up for safety was celebrated, and new freedom to speak up guardians were appointed into senior hospital leadership roles. Schwartz Rounds were mentioned by Robert Francis in the mid-staff's public inquiry as an example of a way in which teams can be brought together to recognise that they are part of one team working for the benefit of the patients. A really tragic but very effective way to increase uptake across the country. The King's Fund subsequently financed a pilot between 2009 and 2013 for Schwartz Rounds to be trialled in 2 hospitals in England to assess their applicability in a UK setting. The pilot demonstrated that by 2010 that rounds had not only successfully transferred to England, but were firmly established and ongoing, with support from the very top of the organisations, having demonstrated not only a need, but a great value to the staff who participated. The Point of Care Foundation then took over licensing and holds a currently unique partnership with the Centre for Compassionate Care. In the UK, applications are made through them. They support implementation and training across the UK through a central lead team. From the initial pilot of 2 centres in 2009, by 2013, there were over 40 organisations regularly running rounds. Today, that number stands at over 280. A national independent large-scale mixed methods evaluation of Schwartz Rounds was carried out by a team from the researchers from King's College London and the University of Sheffield. It was a really robust 30-month study funded by the NIHR as part of a funding stream for research following the Francis inquiry. It concluded that compared with other interventions, rounds offer a unique wide, all-staff forum to reflect on the emotional impact of providing patient care, offering opportunities for staff to reflect whether or not they chose to disclose, contribute to discussions. Rounds came to Australia and New Zealand in 2017. Rounds are now regularly run in 20 sites across Victoria, New South Wales, Queensland and Tasmania. Salon were the first site to hold rounds in South Australia, but hopefully that's not going to be for long. The spread of rounds in the US and across to the UK and beyond, combined with the fact that once having started them, most organisations continue with them, is very supportive to the argument for the value of rounds. The NIHR also compared Schwartz Rounds with 11 other wellbeing interventions, including the link groups, resilience training, mindfulness, critical incident stress debriefing, and reflective practice groups. And that team found more evidence supporting Schwartz Rounds than any of the other interventions, concluding that rounds offer such a unique feature that none of the alternatives provide. Schwartz Rounds offer a safe, reflective space for staff to share stories with their peers about the work and its impact on them. Attendance is associated with a statistically significant improvement in staff psychological well-being and positive changes in practice. I have been accused of advocating for a soft approach by highlighting the constant need for improving compassion. Comments and reflections that this generation just really needs to toughen up, that surviving hard times is the making of you, and I appear to be advocating for lowering standards. The evidence really does not support this. I am not advocating for so-called idiot compassion, which can manifest as a reluctance to have some difficult conversations in an attempt to be nice. This is very much not compassion. Compassion is the emotional response that we have to another's suffering, which causes an action response in us to try and alleviate that same suffering. And there is evidence from multiple workplace environments which all demonstrate that improving compassion within your workforce improves performance, making this not only a moral, but also a financial and a patient outcome-focused case for change. But Schwartz Rounds are by no means the only evidence-based wellness intervention that focuses on compassion. I am sure that many of you here are absolutely on this journey. The work by Mary Freer, the book Compassionomics, and the movement Civility Saves Lives, to name a few, are phenomenal resources in this space that I would encourage you to check out. I've talked about the horrifying number of potential deaths implicated in the Francis report, and we acknowledge the link between staff psychological distress and patient safety. But what is the data that supports Schwartz Rounds, and can we directly link running rounds to safer care? Sadly, the business case is not that simple. But as expected, the evidence supported Schwartz Rounds is qualitative and based around staff rather than patient experience. But what it does highlight again and again is that Rounds makes staff feel supported and heard. Rounds reduce culturally challenging hierarchies and help support a change to a more transparent and compassionate culture. In the UK, the national evaluation did not attempt to show whether Rounds impacted on patient outcomes due to the challenges of designing a study which could demonstrate a direct impact because of so many other confounding factors which come into play that just cannot be isolated. The Point of Care Foundation in the UK, however, did commission a report by Pro Bono Economics in 2019 that showed reductions in absenteeism alone had a 40% return of investments on the institutions that regularly ran rounds. What we know also from the evidence about the original evaluation of Schwartz Rounds in the US, which has been replicated both in the UK and subsequent pilots elsewhere, that staff who attend rounds report that they're better able to communicate with patients compassionately and are able to care for them better. As a key element of patient-centred care, this impacts on how pain is felt, on time to recovery from illness, the number of investigations required, hospital length of stay, which makes a really powerful economic argument in favour of running rounds in the long term. Professor Maben's work in the UK has also shown that the proportion of staff suffering with psychological ill health half in those that regularly attend rounds. If we translate that to our South Australia, using data from multiple surveys, including I Work for SA, the potential benefit to staff numbers across SA alone is in the thousands. It's really interesting as I reflect on how passionately I talk to people about rounds. I kind of see this vague expression of confusion on their face, as if I'm part of this secret society that you're not in until you've experienced a round in the flesh. So I'm going to try my best and explain what you should expect to experience when attending rounds. Literally follow me looking through the looking glass. Pre-COVID in the UK, we focused on a patient story, and it was members of the team involved with that patient care who were asked to be panellists. Post-pandemic here in South Australia, we've focused initially on a theme rather than a case for the introduction of our rounds to try and create as much opportunity for relevance and self-reflection as possible. A significant amount of work goes into planning and preparing for the rounds, and this includes sufficient preparation of your panel members. It is vital that their stories reflect the emotional aspect of their interactions and do not move to problem solve or create a linear narrative. On the day, these panellists, the clinical lead and co-facilitator, are all up front with the audience staff facing them. The clinical lead starts by sharing Kenneth's story, his vision, the purpose for rounds, and it highlights that these are on meaningful reflections. There is discussion about the need to maintain confidentiality for the stories shared and for the participants courageous enough to share them. There is clear signposting for psychological support, and there is no mobile phones and photography allowed in rounds. One by one, the panellists are introduced and each spend between 5 and 7 minutes talking us through their story. After the last has finished, there is a pause for reflection for the whole group. And there are different techniques that you can use to try and focus attention onto the emotions of the room. Tech has come on somewhat in the last 15 years, and word clouds are amazing to create this in real time. Next, you invite the audience to share their reflections. Ask what resonates most with them, how they are feeling. As facilitators, to be honest, it's a bit of a heart-stop moment, hoping that someone is going to raise their hand and to speak. The ongoing facilitated discussions are a guided reflection and a sharing of emotional experience. No answers or expertise in these areas are sought. The focus is very much on staff experience, on the real emotions that they felt, rather than sharing any narratives. In my personal experience, this is really tremendously powerful and can often be a catalyst for self-reflection on a situation that does not necessarily need to be shared openly. I absolutely have had many of those moments, identifying at times on a really gut-wrenching level the emotions being described by a colleague that I have never met. I did not need to speak to feel that I had been heard. And those awful moments where your inner critic is undermining your many, many years of hard work suddenly become easier to cope with, knowing that absolutely in those moments you are not alone. Those unspoken moments that occur time and time again are perhaps some of the most important catalysts for change in your organisation, for it's these reflections that often spark the tea room chats, the informal peer support within units and departments that's so incredibly valuable for culture change. 10 minutes prior to the close of rounds, the facilitator summarises some of the emotions in the room. The round is then formally closed with a reminder about the normalities of your emotional response, encouraging you to have ongoing discussions around the themes, but to respect the names and the stories of those courageous enough to share their experiences. Some centres choose a quote or a piece of poetry to include in their closures. Others may take a mindful breath to focus the room before allowing staff to continue with their day. There is a really important distinction about what Schwartz Rounds are and the purpose that they serve. Staff naturally wish to assist in supporting colleagues and start to problem solve, which can be really challenging to facilitate that back to the emotional response. Institutions will generally run multiple types of rounds, and having good connections into the leads that run those to flag or signpost emerging themes or issues is really, really important. But Schwartz Rounds are not rounds to debrief clinical situations or provide critical incident debriefing is a vital event for staff wellbeing, but should occur within the departments and only with the personnel directly involved. It should have a focus on safety, system improvement, and some trauma-based counselling. Feelings and emotions from such events can absolutely be discussed at Schwartz Rounds, but with a really very different focus, seeking to support staff, to nourish compassion for ourselves, for our teams, and our patients. Thriving organisations will run multiple types of meetings and rounds, many with some psychological aspect, and by doing so will really embed a compassionate culture and hence make your rounds more successful. It's abundantly clear that improving staff wellbeing is an urgent and pressing problem internationally. I feel excited about the opportunities that exist for us here in South Australia, and I also feel that Schwartz Rounds are an important part of this work. As I reflect on the personal drive that's kept me focused on rounds, the biggest by far is that staff both want and need this opportunity to be heard. It helps enormously that this is a respected, evidence-backed programme used in thousands of hospitals across the world, which is a tremendously useful response to those naysayers. The COVID-19 pandemic presented us many challenges, but also forced some opportunities. Discussions with other centres across Australia have been so helpful in planning about how best we can cater for our unique geographical spread in South Australia, and hybrid rounds seem like the obvious starting point, which is both equitable and sustainable. In these rounds, the panellists and the facilitators and a proportion of our participants would be on one site face-to-face, with a second facilitator and additional participants either on a different site or completely online. The round starts all together before splitting to be facilitated separately after the panellists have shared their stories. This requires some extra recruitment, some training and some IT skills, but would seem the obvious next step. Unit-specific rounds have also been introduced that have less impact regarding whole of organisational culture change, but do show a clear benefit regarding individual teams' wellbeing. These also have some additional training, but are included in the same licence agreement and are of great value to units who experience very specific social or emotional issues. In South Australia, we have really challenging geography and multiple satellite hospitals and clinics in each of our local health networks that sets us apart from the setup both in the US and the UK, where licences only cover individual sites rather than networks. The Centre for Compassionate Care are receptive to ideas regarding how we can collaborate to work towards a better solution for South Australia. With the Metro LHNs all seeking to implement rounds, I wonder if a wider conversation regarding a statewide licence for SA Health would be appropriate. This would require a central lead team, with LHNs all having planning committees and facilitators, but allow much sharing of resources and facilitation that I believe would be an incredibly successful process for the state. It would be significantly less resource intensive and support a team to deliver high quality rounds in a much more sustainable way, allowing equitable access to our rural and remote communities. Workplace wellbeing is absolutely no longer a nice to have, but a robust science backed by a significant amount of high quality evidence showing a very clear relationship between clinical burnout and patient harm. The work done in the US that I was benefited from by going to the Stanford CWO course very much demonstrates that there is no low hanging fruit, no quick wins, and there's definitely no one size fits all solution. We must all work together to find a way to put a well-being lens on absolutely everything we do, to find our opportunities, to remove our barriers, to improve burnout levels, our efficiency of practice, our culture, and to promote self-valuation and compassion. I am not for an instant suggesting that Schwartz Centre rounds are the answer to all our problems, but as an organisational wide intervention, it does fall into a community building intervention, demonstrating at least some commitment and acknowledgement by our lead teams of the pressure and challenges we are constantly under. My experience of rounds in the UK, how they have stayed with me and caused me to continue to drive towards change, and here leading them in South Australia have demonstrated that this is a niche that our teams not only want, but clearly need. We have already established a statewide community of practice here in South Australia, which is a wonderful forum to share learnings, support experiences and best practice. And I'm also representing South Australia on the Australia-New Zealand community of practice based from the Centre of Compassionate Care. I feel that we are absolutely in a great position in our governance structure, but also to sustain this project across the state as we move forward. Although Schwartz Rounds have been assessed and widely implemented in the United States and the UK, they are yet to be formally evaluated in an Australian healthcare setting. We are keen to explore sharing our experiences more widely and formally, and have reached out establishing ethics approval to collect our evaluations for this purpose. We are also partnering with a team in New South Wales to collaborate and publish further. I believe that the power of our collective experience will demonstrate unequivocally a financial, compassionate and safety-focused evidence base to embed these programmes into our workplace. A little pitch for our next round. So if you are a Salon employee, I would love you to come and join us on Tuesday at 1:30 in Lecture Theatre 3. But for those in other Metro networks, I understand licences are in progress and these are the names of your leads. So please do reach out if you're interested in getting involved. I wish to end my talk with the conclusion of both Sir Robert Francis and also a study from New Zealand led by Joe Sinclair, one of my Stanford alumni, looking at the value of Schwartz Rounds in promoting emotional well-being of healthcare workers. Sir Robert Francis reflected that the uninitiated may wonder what is the difference between a round and a less organised get-together between colleagues. Rounds are effective because of the commitment of the organisation to them, the support that is given to those that organise them, and not part of some top-down management process. These words absolutely capture my experience that rounds are 100% for staff and have no ulterior motive. I hope that South Australia can continue with that commitment. Joe Sinclair's team concluded that there is an organisational imperative to ensure that staff have the opportunities to process intense emotions associated with healthcare work. In my experience, both here and in the UK, Schwartz Rounds provide all staff with that experience. Thank you so very much, and I will stop sharing and take any questions you have.
Thank you so much, Alison, for your fantastic presentation.